Welcome to our podcast on children and cancer. This video will answer some common questions that may come up with a cancer patient's children and what to watch for. How do I help my child understand my cancer diagnosis and treatment?
The way in which you deliver the information will be unique and specific to your child. Whatever our recommendations during this podcast, we acknowledge that you know your child best. We recommend that you choose an appropriate time for the conversations so that it will not feel rushed and provide space for questions. Share age-appropriate information and use accurate words. For example, use the word chemotherapy rather than medicine, or cancer tumor rather than a boo-boo. This helps children distinguish the difference between cancer and a cold or flu. Sometimes tools such as books or drawings can be helpful in explaining what is going on.
It's important that your child understand the following 3 things. First, the child needs to know that they didn't do anything to cause this, and they also need to know that they can't catch your cancer. Second, they need to know who's going to help take care of them and meet their needs as routines change. And third, they need to know how they can get more information. Give older kids choice. They may need to be asked, how do you want me to let you know when things are changing? If you have a child who likes to read or do research, then giving them safe resources to do their own research may work well. It's helpful to let children know that this is an ongoing conversation and they can always come back to you with more questions. Finally, we'd encourage you to figure out a way to say, I don't know, because this may be the correct answer to their questions.
How can I help my child adapt to the changes that accompany a diagnosis or treatment?
Acknowledge that things may look different for a little while, but affirm who is available to support your kid during this time. For example, mom may not be able to take you to soccer practice, but that's something grandma can do. This reassures the child that they are safe and that their needs will still be met, even if things look different. It's okay to ask friends or family for help.
Incorporate your child into new routines that help them feel involved in your care, such as allowing them to get you a glass of water when you're not feeling well.
How do I help my child express how they feel about my cancer diagnosis?
Your child will have emotions regarding your diagnosis and may be afraid to show them or share them with you. One of the best things is to normalize how they are feeling. For example, sharing with them that sometimes kids feel worried or scared when they see mom or dad sick, and asking them how they feel can help them express these feelings. Your child may need to hear that it's okay to have a range of emotions and it's okay to be happy even though sad things may be happening in your life. Being able to model talking about emotions can help children. For example, you might say, sometimes I feel sad that I cannot play with you because treatment makes me tired. Do you ever feel that way?
Sometimes children don't have the vocabulary to label their emotions, and these emotions can come across as new behaviors or acting younger than their age. This is normal and can lead to conversations. Use questions to help them learn to label their emotions and with their actions, such as, I noticed you were sucking your thumb. Is that because you're worried? Sometimes reading a book about a loved one having cancer can also help facilitate these conversations.
Finally, look for natural supports in your child's life, such as a school counselor, a teacher, or another trusted adult. Consider keeping this adult up to date on your treatment so they can support your child as well. It is natural for older children, especially teens, to seek support outside the family unit.
When should I be worried about my child?
Some reactions and regression is normal for younger children. For example, as we talked about earlier, thumb sucking and bedwetting can be normal. This could lead into discussions with your child about how our bodies are linked to our emotions. It's important to seek outside support if you're seeing behaviors that are going to cause long-term consequences, such as failing classes, withdrawing from social interactions, hurting themselves, or making comments about hurting themselves or others. If you notice any of these, seek outside support, such as professional counseling or intervention at school.
What do I say if my child asks if I'm going to die?
This is the question that all parents are worried about. It brings up a lot of feelings for adults too. Thinking about how you will respond to this question prior to addressing it can be a way to help manage your own worries about being asked this.
As hard as it's going to be, if a child is able to ask, then it's likely that this is something that they've been thinking about. Acknowledge this fear. It's likely the child has known someone, perhaps a pet, a grandparent, someone in a movie, who has died from cancer. At this time, it can be helpful to focus on the knowns rather than the unknowns. Acknowledge that some people do die from cancer, but label the goal that you and your doctor have right now. You might say, "My doctor and I are focusing on treating the cancer with chemotherapy." Affirm that it's okay to ask this question and let them know that you will tell them as changes occur.
These are hard conversations, and it's normal for a parent to want to protect a child by not sharing hard information with them. But we know that truth-telling is a part of relationship building and intimacy. And hearing this from you, the parent, reinforces that you are the primary source of information. Sharing information with the child shows them that they are a part of the family and acknowledges that their life has been impacted by cancer as well. This is a huge opportunity to build trust and keep open conversation going in your family.
How could a support group help my child?
A support group could offer education, peer support to bring the child out of isolation, and provide a trusted adult in the context of their parents' cancer treatment. It can create a link between the emotions and their experiences at home.
For example, here at Swedish, we have the CLIMB program, which is an educational support program for some families. CLIMB stands for Children's Lives Include Moments of Bravery and is part of the Treehouse Foundation. CLIMB has 3 main goals. 1, to create community and decrease the sense of isolation that children may experience. 2, to provide basic education about cancer and treatment, to take away the mystery of what is cancer and how is it treated. And 3, to build basic emotional intelligence, creating a foundation for kids to express their emotions in a healthy manner and encourage children to continue these conversations at home.
Thank you for joining us today. If you have questions, please talk to your social worker.